All right. So as I said, my name is Maddie Taterka. I am the Worker Benefits Coordinator here at the U.S. Federation of Worker Cooperatives. And this is our webinar on our voluntary disability and accident insurance program. Today we're joined by our broker partner, Matthew Tay. We also have several of Federation staff on the line supporting behind the scenes in a couple different ways. We've got Mo Mankling, our policy director, Elizabeth Lopez, our operations manager, and Sheila Quintana, our communications coordinator. So today the webinar, if you've been on one of my worker benefits webinars before, it'll be pretty familiar, the format. We'll start with an overview as a whole of the worker benefits program that we offer here at the Federation, all the different types of benefits your workers and workers in your worker cooperative can access through being a member of the Federation. Then we're going to go more in depth into what voluntary disability and accident insurance benefits are, what they include, and what they cost. Then we'll talk a little bit about the enrollment process, how to sign up, and some important dates to remember and to consider when thinking about rolling out these benefits. And then we'll have time for your questions and answers. So to begin, I wanted to do a brief overview of what we offer through the Worker Benefits Program. The Worker Benefits Program started a couple of years ago offering dental insurance and then vision insurance as a group benefit that different members of the U.S. Federation of Worker Cooperatives can join. We offer a group plan, and that gives people the opportunity to get the better rates and richer benefits that come from being in a large group that small groups can often not access. So rather than having 40 groups of 5 to 20 people, we're talking a group of over 500 people that everyone gets the benefit of being together in. With accident and disability insurance, which we're going to talk about today, these are new benefits that we're offering for 2021. And again, we get the benefit of a rate for a larger group of people. We also offer some tax advantage reimbursement plans, which you might know as a health savings account or an HSA, health reimbursement account, or flexible spending account. We have a partnership with a firm that does those and sets them up for individual businesses. And then we are going to soon offer some referrals to different options for accessing retirement savings. And then we also offer group health insurance in some states through our broker, Diversified Human Solutions. And yeah, we've got some various resources on how to access health insurance as a group, as it is challenging in this country. And so in addition to getting those better rates and better benefits, you also, by being a member of the Worker Benefits Program, get access to me, the Worker Benefits Coordinator, to support with troubleshooting, with administration, and just keeping track of important dates, important things to remember with paperwork, etc. And so I always like to start off these webinars about worker benefits with an acknowledgement and a reminder that while we're talking about insurance and costs and things that it includes and excludes, the Federation and myself personally, we are fighting for universal health care and believe that health care is a human right and that everyone deserves access to all of the types of health care that they need for no cost and in an accessible and inclusive way. So we create the Worker Benefits Program to respond to our reality now that we have this insurance-based healthcare system and lots of people access healthcare through their workplaces. And so as a organization of workplaces, we can make those benefits a little bit easier to access. So I'm always doing this work in the framework that the goal is for healthcare to be available to all. Yeah. So to begin with voluntary short-term disability insurance. It's many words in a row there, which are all very important to describe what this benefit actually is. And so this is a benefit that is offered through the insurance company Colonial Life, which is a private insurance company that by accessing this program, you get the access to the rates through this company. And so in order to have disability insurance that begins on January 21st, our open enrollment period is coming up starting from October 1st to December 9th. And so that's the time to decide, okay, we want this coverage, and to send over the necessary paperwork and initial fees to enroll. And so what voluntary short-term disability insurance does is it offers up to 6 months of partial income replacement in the event that someone can't work. And that period of not being able to work must be because of an injury or an illness that happened because of something that didn't happen in the workplace. So though there is also a sort of rider that you can add on to these benefits to have it cover things that happen in the workplace, but this is for you get in a car accident on a weekend, or you come down with an illness unexpectedly, and for those reasons you can't work. It offers up to 60% replacement of your income for that period of time. And it's important to remember that anybody can be impacted by disability at any time. Any person can benefit from disability insurance. And it's not something, while disability insurance companies often offer different rates depending on age or pre-existing condition, it's not something that picks and chooses depending on your demographic or your age. And like I said, I know that so injuries or illnesses that happen on the job or inside the workplace often are covered by workers' compensation insurance. And that, especially within worker cooperatives, is not always available or accessible or necessary to provide from a legal regulation standpoint. And so in the event that that's necessary, we have an option to add coverage for on-the-job incidents. And so to go a little more in depth on the types of scenarios when disability insurance might be particularly useful, people who have chronic health conditions that may eventually impact their ability to work, even if they don't right now. So progressive conditions, autoimmune conditions, chronic viral conditions, HIV, hepatitis, things that can flare or increase in severity over time. Short-term disability insurance can be very useful for people who experience those types of conditions, as well as people who have manual labor jobs or jobs that require any sort of activity that would be impeded by an injury or illness. In addition, disability insurance, it can be used to provide leave for people who are going to become or are planning to become pregnant. Disability insurance is not a substitute for parental leave overall, because it only covers people who are experiencing pregnancy. But it is, if you're expanding your family in a way that does mean that you're going to be pregnant, disability insurance can offer some paid leave for that. And of course, this isn't an exhaustive list. Disability is a diverse and varied term, and covers all sorts of experiences that we can have in our bodies. So I know this is a lot, and is pretty complex, and so I wanted to give a couple different scenarios of how disability insurance might come into play for someone in their day-to-day life. So for this scenario, let's say we have Tom. He's 45 years old. He works as a bike messenger. So in order to do his job, he needs to be able to ride his bike. Let's say Tom then breaks his leg in a car accident while he's out of work. And so he obviously can't be riding his bike until his leg heals. So disability insurance can kick in for a period of time while he's recovering, and that helps him cover his living expenses during that time. Yeah. Then we have an example of someone who works a job in an office. This is, in this scenario, we have a person who's very young, 23 years old, working an office job, and out of nowhere they have a mysterious abdominal pain that they experience and have to leave work for a few months while they figure out what's going on, create a treatment plan, and are able to stabilize their health. Disability insurance can kick in. It's often used after someone exhausts their paid sick time, or if someone knows that they're going to exhaust their paid sick time. Short-term disability insurance can, again, step in to help cover rent and basic expenses while they're out of work, while the workplace is no longer paying for their time off. And in this scenario, we have a person who is living with a chronic condition, living with Crohn's disease, and has disability insurance so that in the event that she has a flare-up and can't work for an extended period of time, she knows that disability insurance will be there to cover that time that she can't work while she's taking care of her health and stabilizing again. And so I think this is particularly important because one thing that I'll be talking about later is that not all disability insurance will cover existing conditions, pre-existing conditions after the person enrolls, if the condition already existed. And with this disability insurance that we're offering, it will be basically guaranteed to cover any pre-existing chronic condition after a certain period of time. So we'll get into that more, but I just wanted to highlight that this scenario is not always feasible with disability insurance, but with these benefits that we're offering in this particular plan, it is. So it's something that should be taken pretty seriously in thinking about if this is the right plan for different workplaces, your workplace. So for the costs of disability insurance, this particular type of disability insurance, known as voluntary disability insurance, the voluntary part means that workers elect to sign up for the disability insurance and they pay for it themselves. So unlike with some of our other programs, with disability insurance and also with accident insurance, The only cost for the workplace is a $75 annual fee to basically get access to this program for the workers in the workplace. So the workplace pays the $75 annual fee to the Federation, and then the individual pays on a recurring basis to the broker, Diversified Human Solutions, to access the benefits. There's an equation that goes into explaining how much the benefit costs, because it's based on age, state, and also how much income the disability insurance would be covering month to month. It's also important to note that because it's a voluntary insurance and it's being paid by the worker, it's being paid after taxes, and therefore all the disability income that someone would get from their benefit is not taxed. It's an after-tax benefit. So although someone is only receiving up to 60% of their wage before taxes, the 60% ends up being close to on par with take-home pay. And we'll get into some of the details of the costs now. So going back to our example of Jillian, let's say Jillian, who is the office worker, lives in Maryland. And so this person is enrolled in the disability insurance program through the Federation, which means that they're eligible for disability insurance for up to 60% of their income pre-tax. And so we see here that Jillian makes $3,750 a month before taxes, which means that Jillian can sign up for 60% of $3,750, which is up to $2,200 in disability insurance. Again, not taxed. And so as a 23-year-old living in Maryland, we have a whole table of the rates for each state and age that is available on our website. So Jillian would pay $2.14 per $100 of that benefit. So the benefit gets divided by $100, multiplied by $2.14, and that results in paying $47.08 a month in order to know that if they needed to activate their disability insurance, they would be eligible to get that $2,200 each month to cover living expenses, healthcare expenses, whatever they would need during that time. This also works for people who make their salaries or make an hourly wage. So with people's hours that vary month to month, the calculation is based on basically an average of their monthly hours. So in this scenario, Tom the bike messenger earns $15 an hour, works about 27 hours a week. And again, we have the calculation based on earning $1,620 a month. About 60% of that is $1,000. So as a 45-year-old in California, Tom pays $2.77 per month, or per $100 of his benefit per month. So it's 1,000 divided by $100 times $2.77 equals Tom paying $27.70 a month in order to have those disability benefits on hand. Thank you for bearing with me on my math. So like I said before, we have this sort of limited time offer on the disability benefit being guaranteed issue for during this open enrollment period, with no one being turned away for any pre-existing conditions that they have, and no pre-existing conditions being excluded from the benefit. It's very common for disability insurance companies to deny coverage for pre-existing conditions. And pre-existing conditions, just to be clear, are medical conditions that already existed before the insurance policy started. So in the example of the person who had Crohn's disease, if they had Crohn's disease for a number of years and went out and got just any disability insurance policy, that disability insurance policy might not cover leave related to that Crohn's disease. But with this plan, that would be covered a year after the plan begins. So there is a waiting period, but in the case of a disease or a condition that lasts over a many-year period of time, it can really be worth it to lock in the guaranteed issue disability insurance, so that years into the future, income is protected. And another really important piece of this is that because the benefit is voluntary and paid for by the worker, it is not actually tied to the workplace where the worker got the benefit through. It's what's called a portable benefit, which means that even if the worker leaves the workplace, they can take it with them if they change jobs, and it doesn't impact that pre-existing condition guaranteed issue scenario. So it's really sort of a many-year investment and opportunity for people to get access to this benefit at again a pretty low cost for the organization itself. And it really will then help workers in the organization for the time that they're at the organization and then beyond. And again, to illustrate this timeline, we have guaranteed issue. If you sign up during this 2021 open enrollment, it means that any disability that originated before January 2021 will be covered beginning January 1, 2022. Then you've enrolled during open enrollment this year. January 1st, coverage begins. If the next day you have an accident or get a diagnosis or need to leave work for a disability-related reason, that would be covered effective immediately. Then a year goes by, January 1st, 2022. Then any disability leave that originates at any time in the past is covered after that point. All right, so that wraps up the disability insurance description for now. We'll have time for questions and answers. I know it's a lot of information to take in, and there's a lot of different layers to it. So now I'm going to talk about accident insurance, which is a little bit more simple than how disability insurance works. So accident insurance offers a set of one-time payments in the event that someone experiences an accident, like a car accident, like a an accident you might have in the kitchen, in the home, doing home improvement things, like anything that's an accident, that's unexpected. You get fixed one-time costs or one-time payments to help cover costs, whatever you need. So they allocate a different amount of money that they will pay out for each sort of event that happens related to the accident. And then you get that lump sum to help cover those costs and to help support you in whatever way you need. It's not something that's tracked. You can spend it on whatever it is that you need most. So accident insurance is a supplement to medical insurance. It's not a substitute for health insurance. It can be a stopgap. It can help cover costs that health insurance doesn't cover, or it can be something to have if for whatever reason you can't access health insurance. It can be sort of a better to have something than nothing kind of scenario. And yeah, it applies to accidents that happen at work or outside of work. So it's not following those same lines that disability insurance does. Accident insurance, the costs also vary state by state, but it's a lot more straightforward just in terms of what the costs are. Like with disability insurance, it's a voluntary program, which means that individuals pay for the accident insurance. It's not a cost that is taken up by the workplace. So the only incurred cost to the workplace is $75 a year to the Federation for support with administration and access to the rates and the work and research that we do to support the program. And accident insurance can also be, it can include coverage for partners as well as children. And so I've included here just a sort of sample table of what the costs are generally. And this can vary a couple dollars in either direction depending on the state. So yeah, I missed a piece of the slide. But this is, we can revisit the scenario of Tom who is the bike messenger who broke his leg in a car accident. So let's say Tom has a child who he and the child are both covered by accident insurance. They take an ambulance to the emergency room where they both get checked out. Accident insurance will pay out a lump sum to Tom for his emergency costs, the cost of the ambulance, the fact that his leg was broken, and will also pay out lump sums for a certain amount of physical therapy sessions in this scenario. And so on our website, we actually have a brochure about accident insurance that enumerates what some of those payouts would be, and it's very detailed. Once a certain amount for an emergency room visit, a certain amount for an ambulance ride, a certain amount for XYZ types of x-rays or injuries, and then that all sort of just accumulates and you get that amount of money to do whatever it is that you need to do to take care of yourself. And so this slide applies to both accident and disability insurance. Because it's a voluntary program, the sort of restrictions on who can sign up are pretty broad. So it's basically anyone can sign up if their organization is a member of the Federation and the organization signs up for access to the benefits. People also have to work an average of 20 hours a week to get access to the rates. There is no minimum there's no minimum threshold on how many or what percentage of workers in an organization have to enroll. So honestly, even if just one or two people from an organization are interested or would benefit from these disability and accident insurance options, it's it's a pretty low level investment for the organization to have a very long-term positive benefit for those workers that are interested. For billing, there is going to be an automatic monthly payment system to Diversified Human Solutions directly, who are, again, the broker. And if there's any questions related to that, we have Matthew Tay from Diversified Human Solutions on the call to help answer those questions. So just to summarize, we have the two benefits offered here. We have the voluntary short-term disability insurance, which helps replace income up to 60% in the event that someone can't work because of illness, injury, or pregnancy and childbirth. It's for off-the-job illness and injury only unless you add that on-the-job rider for people who are not covered by workers' comp. This is coverage only for the worker themselves. It doesn't offer coverage for a spouse or partner or child. And the cost is based on your income, the state you live in, and the age. For both of these, it's paid for by the worker. And then for accident insurance, like I said, it offers fixed payments for different events that happen as a result of an accident. It's for things that happen on the job or off the job. It can include dependents or partners. And the cost is based on state and family members. It's actually not based on age, up to age 80, I guess. Also paid for by the worker. We do have an option that I'm not going to go deep into because it is very much based on different workplaces, but for workplaces that wish to pay for disability insurance for their workers, it's kind of a whole different rate setup. It's based on some demographics of the workers as well as the type of work that's done. And so if you're interested in that, email me at benefits@usworker.coop to talk more about that. All right, so that concludes my presentation here. Again, I'm Maddie Taterka from the Worker Benefits Program. You can reach me with any questions at benefits@usworker.coop or call me at that number there. And then we also have Matt Tay here, who is from Diversified Human Solutions and helps us out so much with getting access to these rates and answering all of my questions and many, many of your questions as well. So yeah, I will open it now to questions, either in the chat or you should be able to unmute yourself. And Matt, if you want to say anything as well, feel free to jump in.
Yeah, thanks for doing that. Really, the primary thing would be for the disability, the guaranteed issue. That doesn't happen frequently. Or really, it just doesn't happen at all, period, full stop. So, this is I think a two-time opportunity. So you have an opportunity this winter, and then it will be next winter, and then that ship will have sailed. Pregnancies are covered. You just can't be pregnant when you sign up. You have to sign up, then get to work there. And then I would say the accident and disability, if you're a worker-owned co-op, and depending on your workers' compensation laws, it might be something to look at, depending on what industry you're in. I know some industries in like Pennsylvania, if you work with trees and roofs and chainsaws and stuff like that, where workers' comp rates can get pretty high. So I would say those would be the three big considerations. Then all the information's out there in terms of the prices on the Federation website. And, feel free to reach out.
Thanks. Any other questions? We've got a pretty small crew here today, so don't hesitate to speak up now, because I'm sure even if no one else is on the call that has your question, other people will watch the recording. I'm sure we'll appreciate clarification. All right. Well, in that case, I guess we will just wrap it up now.
Maddie, I actually do have a
Oh,
question.
great. Mm-hmm.
It took me a second to find the mute.
Sure.
My name is Brooke. I'm calling from New Mexico.
Great.
And I'm working with a group that will not have incorporated yet by December.
Mm-hmm.
And I'm wondering if there's a way that they can still do the disability insurance, because I know the workplace has to pay the $75 and there won't like be an official workplace yet.
Yeah, so I think, we've talked about some of this, you and I, but the guaranteed issue is it's this one time now for existing members of the Federation, people who are eligible for it. But as people become eligible for it, whether they become a new member of the Federation or they're new workers in a workplace, that guaranteed issue will be effective for the period of time, that 3 months, I guess, after joining the Federation. Does that clarify? So it should be okay for your folks if they join the Federation and once they're incorporated.
Great.
Yeah. That's a great question, though. That's a very important piece of it.
Yeah, and I'll throw this out there. I know we talked about health benefits a little bit, and there are things that aren't quite health insurance, like skinny plans. There's a lot of stuff out there, short-term insurance. There's different HRAs and stuff that you can do it, but it's kind of a weird thing to think about or say. But if you can't afford, I know some places in New York and New York especially, it's like $800 a month for health insurance. It's astronomical. So in terms of cobbling together different health options and benefits, this might be something that you want to look at if that's your situation. Just a heads up.
Yeah. Matt, one question I had is I realized I actually didn't know if the partner designation for accident insurance, if there needs to be any kind of particular documentation of partnership for people to qualify for that.
Yeah, it's pretty lax. It's domestic partner, right? If I read the language correct.
Mm-hmm. That's my understanding.
Yeah. Typically, a domestic partnership can be proven with a proof of cohabitation. Mm-hmm. So an invoice that you share. If you both have the same address on your government documents, whatever those government documents may be, that'll suffice.
Great. Thanks. All right. Well, I think I'll wrap it up there. Thanks so much to Matt for being here, to Susan for interpreting this whole time, and to the rest of my colleagues for being on the call, and to our guests. I hope this was helpful, and as always, feel free to let me know if there's any questions or clarification I can offer later on. So thanks very much.